Hi, I'm Dr. David Hill, and today we're going to talk about how to ease infant cold symptoms. Seeing your infant get a cold just has to make you uncomfortable. They do not look happy. Why? Well, having a cold is miserable anyway, and it may be your child's first experience of a cold. However, there's another important thing about colds in infants, and that is that infants, especially newborns, have to breathe through their noses in order to nurse or to eat comfortably. So especially in that first 6 months of life, when nursing is a huge part of the child's diet, often the only part of the child's diet, a stuffy nose can be a real problem for eating and obviously for sleeping as well. What are you going to do about that? Well, the easiest remedy you can make up in your own home. You want 1 cup of water and you want a ½ teaspoon of salt. You're going to put the salt in the water and then probably microwave it or boil it on the stovetop and let it come back down to room temperature. You don't want to put hot water on your child's nose. And then just dribble 2 or 3 drops in each side of the nose. Let it sit there for a few seconds and suck it back out, probably with that suction bulb that you got when your child was at the hospital. It's probably red or blue in color. That will buy you at least a little while that the child should be able to breathe more comfortably, enough to get a little bit of food, enough to get a little bit of rest. When you use the bulb, you don't have to jam it way down in the child's nose. It can be right there, right at the outside of the nose, just close enough to the nostril to suck out the contents. So that's the most important thing to do to relieve the symptoms. Now, in children who are over 2 to 3 months of age, you can give a little bit of Tylenol. You'll probably want to consult your doctor for dosing guidelines on how much Tylenol is safe because it depends on your child's weight. Over 6 months, you can use Advil or ibuprofen. One thing that we absolutely do not recommend at this point is the use of over-the-counter cold preparations in children. No child needs a decongestant or cough suppressant, especially under age 2. They also don't need really homeopathic medications or natural medications. None of those remedies has really been shown to make much difference in children with colds, and I'm always one who says better safe than sorry when you're dealing with young children. Finally, if your child is under age 3 and has age 3 months and has any fever at all, that is a temperature over 100.4 degrees rectally, please contact the doctor. That may be an emergency. If your child is over age 3 months and has a fever over 104 degrees, contact the doctor. That's probably not just a cold. Still could be, but much less likely. If your child has a fever that goes on more than 3 days, it's probably not just a viral infection anymore. You're still going to want to talk to the doctor about that. And if your child has cold symptoms that go on greater than 10 days, you're also going to want to talk to the doctor about whether he or she might benefit from antibiotics. Talking about how to relieve the symptoms of a child's cold, I am Dr. David Hill.